Hi everyone, I'm Susie Paul and I did my practicum with Island Health. And my project was an evaluation proposal for Island Health's food security program. So just to briefly give a little background, 3 years ago Island Health shifted their funding model for food security to a community development model. So since implementing this new model, it's time to evaluate whether or not it's an improvement over the previous approach. So before I get into my project, I'll give a little bit of background on food security and the Island Health approach, and then I'll talk about my project. So what is food security? I had this question many times over the last few months, and this is the answer according to the Food and Agriculture Organization. Food security exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious foods, which meets their dietary needs and food preferences for an active and healthy life. So there are 3 pillars to food security according to the World Health Organization. The first one is availability, so meaning there's sufficient quantities of food on a consistent basis. The second one is accessibility. So an individual or family has sufficient resources to obtain appropriate foods. And finally, utilization. So this definition of food security implies that human dignity is not compromised in order to obtain food, that food is safe, nutritionally adequate, personally and culturally acceptable, and that food is sufficient in quality and quantity, and that it's produced, processed, distributed in a manner that does not compromise the environment for future generations. Also, it's important to note that the availability of food does not ensure accessibility, and sufficient calories does not ensure that the diet is healthy or nutritious. So diet impacts health in many ways in all stages of life, and I won't go through all those connections today, but I will say that food security is the foundation for healthy eating, and being food insecure is closely linked to chronic disease. So for this reason, or these reasons, food security has gained greater recognition in public health and is now a core public health program mandated by the Ministry of Health. So food insecure households are more likely to experience poor health outcomes and lower quality of life. And in Canada, the number of households that are food insecure is on the rise. So right now, 1.6 million Canadian households are food insecure. So that's approximately 8.3% of the population. In 07-08, this was 7.7%, so we are going in the wrong direction. Food security on Vancouver Island is a little bit unique because we're geographically isolated. Much of our food is transported onto the island rather than grown here. So as you can see from this map, each region on the island is different in their prevalence of food insecurity. So on the South Island, you can see that 11.5% of households are food insecure. So that's well above the national average. This information demonstrates the regional differences in demographics and geography, and therefore the priorities when it comes to food security. So this demands a unique approach on the part of Island Health. It's also important to note that there are many offshore communities around Vancouver Island, which sort of complicates matters for food security. So it also highlights why it's important to have regional hubs throughout the island. So the Island Health Food Security Hub program is a coordinated effort between the Health Authority, the Provincial Health Services Authority, the Ministry of Health, and community-led agencies all over the island. In 08-09, Island Health implemented a partnership strategy with community agencies that were previously established leaders in food security in their respective regions. So these agencies are now referred to as Island Health Food Security Hubs. There are currently 7 Vancouver Island regions where hub activity is taking place. So what is a hub? Food security hubs are leaders within their regions, and they promote and support opportunities for collaboration and alignment of stakeholders. And the idea is that they bolster community capacity, develop communication networks and bring people together to talk about food security. And Island Health's role in all of this is to provide leadership and support as well as funding in order to reach the provincial goals for food security. So as I mentioned, there are 7 regions where hub activity is taking place on the island right now, and these are the agencies that are involved. They're all at various stages of development, and they're up and down the island, so in the North Central and South Island. And the program goals. So the long-term goals of the program are directly based on the Ministry of Health's goals within the core program for food security. And these goals include an increase in awareness of food security and related issues, access to local healthy food, food knowledge and skills, community capacity to address food security, and an increase in development and use of policy that supports community food security. So this proposal was for a process evaluation. So we'll look at the last 3 years of data, starting from when the new funding structure was established. So the purpose of the evaluation is to determine whether this funding model is an improvement over the previous approach. Secondly, if any opportunities for collaboration between Island Health and the hub agencies have been missed. And thirdly, if there are any areas where the program model could be improved to better contribute to the provincial goals. And also this evaluation is designed as an opportunity for stakeholders to exchange ideas about what's working and what's not working in their regions to foster empowerment and build capacity. So the methods that I proposed are qualitative and in a 2-phase process. So the first phase is an exploratory process of existing program documents to determine what information we have and what information is missing to answer the evaluation questions. And the second phase is one-on-one, semi-structured in-person interviews of key stakeholders. And the analysis will be thematic analysis. Some of the challenges and strategies to address those challenges are listed here. At the top of the list, respondent bias, geographical challenges, differing regional priorities, and different stages of development. These challenges will be addressed primarily through feedback and ongoing discussions with the key stakeholders and peer debriefing. So monitoring and evaluation of public health programs, as we know, is an important part of ensuring objectives are being met and where possible improvements can be made. It's clear that food security initiatives are extremely important for population health and that Vancouver Island faces unique geographic challenges. So the Island Health Food Security Hub program has catalyzed many food security activities across or through the work of the hub agencies, such as classes, workshops, policy changes, just to name a few. This project proposes methods to evaluate Island Health approach to addressing food security. So I can't leave without saying thank you to my practicum supervisor, Annalisa Blake, as well as the hub leaders and community nutritionists with Island Health. They were extremely welcoming, and I very much admire the passion for the work that they do. I also had guidance from an evaluation specialist, Edith Imber, as well as Melanie Rush, who helped me create the food security maps. And also thank you to Victoria and Kathy for your guidance and support, and to my family for being here today. And that's it. Thank you all for listening.
Comments, questions? Yes.
Great job, Susie. I'm just curious, I didn't notice anything within the key stakeholders or other collaborators in this, the hub of First Nations Health Authority or other First Nation partners. So I just wondered if you could speak to that, because I know that's often a concern.
Yeah, that's a really good question. So there are, within the hub committee, I couldn't go into too much of the structure just because of lack of time, but there is an overarching hub advisory committee, and on that committee there's Aboriginal health nutritionists, and they sort of speak to that. and they are part of another network, VICFN, and that sort of group addresses First Nations food security specifically. They kind of have their own hub in a way, and they work collaboratively with the other hubs in the region. So, good question.
Other questions or comments?
Thank you, Susie. I really enjoyed your presentation. Can you tell us a little bit about the extent to which, if any, rediscovery of more traditional foods or local plants in diets and so forth, the role that might play in addressing issues of food security on the island?
Yeah, so the hub committee and the hub leaders, that's kind of their focus right now. And in November, they had a conference, and it was all focused on traditional foods, and they had First Nations leaders and elders there to kind of share their knowledge with the hub leaders so that the hub leaders could take it back to their own communities and sort of advise and create activities around that. So yeah, that's part of their work as well, absolutely, yeah.
We have time for one more. Yeah.
Hi, thanks, Susie. Susie, you said that the hubs catalyzed some policy changes, and I'd be curious to hear some examples of those.
Yeah, so one example in Port Alberti is the hub leaders work with the regional governments to change these policies. So, for example, they got, I can't remember how exactly it works, but it's something with beekeeping to allow anyone to keep bees in their backyard. And then there was another one, composting facilities. So stuff like that, just make it, and community gardens, kind of allotting more space to community gardens. So those are just a few of the examples.
Okay, thank you so much, Susie. Good job.